past 4 years now. And I did speak to it in my opening address of the impact of the Encompas program on our members and the positivity that it's creating, and with the ultimate out of the whole thing, what we want to get out of that is getting our members that are suffering back to work. And we're starting to see that, trying to quantify it and present it to the powers to be. Because the whole premise behind the program was we have to look after our members, and at the same time, we need to get our members back to a spot that they can function at not only work but at home as well. So we're seeing a lot of positivity with the Encompas program, and I look forward to the next couple of years on how we start showing the results of the program that we've implemented 4 years ago. So without further ado, I'm going to turn it over to Carl for some opening remarks, and then he's going to talk about the program itself. And great.
Good morning, and thanks, John, and thank you to all of you for being here this morning. It's the relationship that Dalton Associates has with the Ontario Provincial Police Association is certainly one that we honor. We feel it's a special relationship that we've gotten quite close to the entire community, to our policing community, the families. It's certainly a real honor for us to continue to serve whatever needs are necessary, and to be a part of the community, and to continue with that on for the future years to come. So I much appreciation, and it's an honor to be here. I didn't come alone. I'll just maybe point out we're sort of around the room here creating a perimeter, maybe of what you guys might say, but I did have some colleagues here first. If you haven't met them before, I was able to drag him out today and get him out of his office to come be here with me for today, and we'll be here for the day and this evening as well, and tonight. But our president and founder, and my dad, Dr. Dalton, a psychologist in the back there. Sure, stand up there, Dad. The truth is, he wouldn't miss it. He begged me to come because he'd been calling me for about 3 weeks, asking me when we were heading up to Collingwood and Blue Mountain. So it's been good, and he's looking forward to chatting with you all as the day goes on. I also have our manager of Encompas, the one that keeps Encompas together. She's responsible for getting it here, not only today, but over the last few years. She holds a team of care navigators together. She's a manager of a program. She's a retired police officer, Jennifer Welsh. Jen, you want to stand up? She's at the back there. And also a manager of all of our first responder programs, or all of our programs actually, that are customized. And she's been working closely in managing Encompas since its beginning, and that's social worker Louise Hansen is also here. Louise, you want to stand up? She's over here. So Jen and Louise and I put together a presentation. I'll honor the time limits here to only 2.5 hours, and then I'll be done to clean up and let you go. I'm kidding, but we'll get started. And we built a presentation that will be interactive, so you'll need to get your phones out. We'll use Menti. We did this in the spring forum, and we'll be using it again. But we're going to start the morning off with testimonials. And I know we are streaming this. These are all testimonials that people have called in or spoken to in person with us. And it's one of the, I think, maybe unforeseen or unique things of Encompas or phenomenons is that the members themselves that have engaged in Encompas are the ones that are driving its positive reputation. They're the ones that are driving and encouraging brothers and sisters to engage in Encompas, engage in wellness journeys, to engage, for family members included, to engage in this, and it's all been done on word of mouth. So since the time when we could come together after COVID, people have been raising their hands and telling their stories at branch meetings. And many of you have been at branch meetings, have invited me there, you've heard them. And it's not just one story, it's usually 4 or 5 personal stories of how engaging in Encompass and working on their self and their family's goals towards wellness has changed their lives. And it's those voices that have created Encompass to be a really successful program and if not a provincial standard for sure, if not a national standard. So we're going to start with some of those testimonials. If you're concerned about confidentiality at all, these have been completely removed of any identifying information, although most people were fine with us identifying them, but they also they are in a real voice, but it's not the voice of the members themselves. So we'd like to play those testimonials for you to put you a little bit in the driver's seat of what the experience has been like for your members.
My experience with Encompas and Dalton Associates was incredibly positive, largely due to the care manager's exceptional support. During a particularly stressful and traumatic period, they went above and beyond to ensure that both my son and I received the care we needed. Her dedication and compassion not only alleviated a great deal of our stress, but also provided us with the reassurance and relief we desperately needed. Her work behind the scenes allowed us to focus on healing without worrying about the details. I'm deeply grateful for her tireless efforts and the incredible peace of mind she provided. Encompas has been an invaluable resource to me and my family. Over the last few years, I've been going through some mental health struggles that were a combination of work and life stress. My care manager and the rest of the team worked tirelessly to arrange a number of resources for me with kindness, respect, and compassion. I have since been able to connect with the right therapist and have the diagnosis I need for proper treatment. My wife also found a therapist to assist her through the Encompas team. I will forever be grateful for all of their help and for the resources they offer to members with discretion and without added costs. I'm eternally grateful to the OPPA for enabling access to mental health resources for myself and my family. The Encompas team has been a godsend during some really tough times for our family, and they understand the challenges that first responder families go through. I get emotional about the time and care that is shown by the Encompas team when they have gently reached out with support to connect when a response has not been received by me. I have needed this at times to keep me connected to the program when I felt overwhelmed. It is through this care that I've been able to meet the ever-changing needs of myself and my family as we navigate the challenges of different seasons of life. It is my hope that all members take advantage of this service so we can get and stay healthy together.
Thanks, Jen. The mandate for Encompass, and I'll go a little bit back in time, not to bore you, but in case it's your first time here, is the mandate of Encompass in 2020 was that no one falls through the cracks, no one gets left behind, and it is a direct response to the suicide epidemic and that started to occur in very high numbers in 2015, 16, all the way through. And that approach was created by the board, by the association at the time, the board of directors. At that time was led by President Rob Jameson. I understand Rob's not here today, is that right? The mandate has stayed the same, that we've developed a full wraparound care system for any member, any family member that calls, and we don't turn anyone away. Although there is obviously clear eligibility, when people call in need, we know the spirit and of the relationship is that no one is turned away or left behind. When someone calls, you do have, it's one central point to a care navigator. It's 24 hours a day, 7 days a week. You have access to counseling in the moment, immediately, by registered master level clinicians. You have access to psychologists, psychiatry, and you have access to probably the strongest relationship and greatest interventions and access to a care navigator. Your care navigator at Encompas is your ally and your advocate. It stays, he or she stay with you for your entire wellness journey until you tell them to get lost or that you don't need any more help. They're with you till the end and with your family till the end. So that means if your son or daughter need an assessment or need to find an apartment or need to find occupational therapists, or you have parents that need home care, your care navigator isn't just there to listen, they're there to find the resources that you need and bring you back options. There's a concierge, similar to a concierge in any other environment. This is really your care navigator is there for every member that calls in. And this slide depicts all the different types of access that you have available, and I'll talk a little bit more about all the different supports that are in place. So within relationship, Encompas is your is a relationship with Dalton and the care navigator, but it's also your unlimited psychological benefits. It's also your unlimited WSIB. It's also your extended life benefits and retiree benefits as well. So Encompas is created from all of the benefits within an association. That makes Encompas what it is. You can't take Encompas and plug it in directly into Toronto Police Service or another police service. You can't do that. Encompas is what the association has built from that, and our job is to navigate around that. So all the services, whether they're in-house at Dalton through Care Navigator, or they're with another agency, whether it's Wounded Warriors or Beyond the Blue, or a residential treatment center. There's a number of other services that we navigate out to, not just individual counseling, couple counseling, family counseling. It's a whole service to anywhere you need to go. We help you get there, and we make sure that service is funded, or the funding is not a barrier to you to engage in that service. There's a virtual component as well. There's a full portal that I'll speak about in a few minutes as well. But there's a full virtual component, so you don't have to fully engage. If you want to just peruse and browse for education, then that's available to you through your own private online portal. So we'll get to Menti here, and the first one is a question to you. We've ordered these, and I guess there we are. Jen's already brought it out, but I think I was supposed to ask him, wasn't I, the quiz? What's that? Top 5 reasons that members of Access Encompass Services program to date, and you can you rank them in the correct order? I see. Gotcha. So now as they move and shift, everybody, they're ranking them. Is that correct? We'll give it a couple minutes. This would be great at a dinner party, right? When you want to bring up politically hot topics, you could just use the Menti to rate them. But the first and foremost one is personal stress that people call in. That's often a general term, and it can actually highlight any of the other things, such as the second, close to anxiety, depression, and panic attacks. The third is then workplace stress, trauma, OSI, and PTSD. The fourth is wellness and well-being. We've seen that increase more and more, but that's usually people looking just to get a baseline. I see a lot of the intakes that come through still, and I've definitely noticed an upward trend of people writing in saying, hey, I don't necessarily have a particular issue, but I want to prevent one, or I want to be prepared when workplace stress comes up as well. And then also the relationship issues, personal, couples, and families. And I would also say that the reason when people call in and the reason for why they're calling in, they think that often will change once you're in therapy, that personal stress could easily be PTSD, and it just be relationship stress could also be PTSD. Someone could come in and say PTSD, and it's not PTSD either, that it is a tragic or traumatic incident, but they may discover later that it's not related. So, but this gives you an idea of the language used, the narratives, the discourse of what people say, how they're starting to talk about their issues when they're calling in. So the high-level summary is, to date, we've had 3,285 people do individual intakes. So that's a pretty incredible number. Of that, your eligible individuals are 3,100, and then we have about 140 that have been ineligible or ineligible. And of course, like we said, no one is, the spirit of the relationship is no one's left behind, and we still make sure that they would go over to the Dalton Associates care navigators ourselves, and they would make sure that they're given a very solid service to make sure they get towards a wellness journey. Of those, about 74% are working in policing in some formats, civilians in on, 11% are on leave, and 15% are retired. So, how many members? I think we've got this out of order, but you have to now guess it. That one's out of order, sorry. The step care service. So what happens when people call in is they go through a step care service experience. So if you have any members join in, they start at the very baseline, which is a care management. You establish that relationship. That's intervention number one. And sometimes intervention doesn't go past that because it doesn't need to. They have a strong relationship with a care manager. They're not yet ready or not needed to go on to another level of service, but they stay connected to their care manager. And that is an intervention. It decompresses the stress right away. So when somebody calls, the care managers are occupationally aware. They're offered in several different languages, and they are able to de-escalate the stress when you're calling in. So usually people call in when it's a little bit too late. They need to call in weeks before, but when they do call, that very initial contact with the care manager, and it de-escalates from there. So it's initial intervention. Then we've had 3,000 go on to counseling services. That's obviously the most common one. People starting to talk about using talk therapy, getting into more specialized, either there's biofeedback or neurofeedback, EMDR, CBT, DBT. These are all clinical terms, but this is when you get into a level of treatment of talk therapy around a different modality. And again, our care manager matches you with a therapist, and it also ensures that that match, the initial match, is the one that is most comfortable. And if it's not a match, which does occur from time to time, then we make sure that we find the right match. And our therapists and the network of therapists are supervised. Predominantly, they have some resident relationships that are also managed through the care navigation system, and they're also vetted very strongly to be occupationally aware, regulated health professionals, no prior concerns, and that they have really good feedback scores from individuals. So peer review is really important to us, and we get that direct peer review from them. So we already know that something increasing in counseling, and that people are staying in counseling because we're getting those matches right, and a lot of that is based on peer review. You can get a psychological assessment. That's a much more comprehensive assessment than a screening assessment. It's done by a regulated psychologist. It can be done in person or virtually, depending on the testing and the scoring that needs to be done. And it's fully available to you with very limited wait times. We have a psychiatry team. This is a very unique resource. It's something that is not easy to come by. And we do have a team of psychiatrists, so we can get those psychiatry consults with again, very limited wait list and time. And we have another layer, another professionals involved in the treatment. We do outpatient, so this would be day treatment programming. This would cover things such as severe depression, debilitating mental health conditions, or addiction. And then there's residential treatment programs as well. Those residential treatment programs are available from anywhere from, I think there's weekend retreats. Joe would have that. There's weekend retreats to go, and so we've sort of built a strong relationship with different treatment centers and modalities, and we can also go and do something very intensive and individualized for up to 90 days. So when someone enters into Encompas, from a clinical perspective, we're putting them through what's called the step care management process. And each level of the way, not only is your care manager there, but there's clinical oversight from psychology, social work that are watching each individual and family member come through. I want to show you a little bit. I think this is again a unique piece of this program. Is these are all the different brands and organizations of relationships that we've built over 4 years, so that you can see that this is a gateway to services anywhere in the province and any type of services that you need. So this isn't something that's just kept in-house at Dalton. We've built strategic relationships. We have a very strong vetting and documentation process, and over the last 4 years we've built relationships with these organizations, because all those organizations are providing unique and wonderful services for police officers and their families, at the very least, and members have requested to go there. So when we get a request to do something, to participate in a program, we hear that, we vet it, we do screening still, and then we build those relationships. And these are only referral relationships, so they're not, like, there's no monetary relationships involved in these. This is all just through networking and organizations that want to be involved in the care of OPPA members and their families. So I don't expect everyone to know all those, but it's quite a unique program that gives access to anything. There's no barriers. I did discuss a little bit about the Encompas member portal. So this is a fully online tool. You can go through 2 different avenues. You can go through one that's managed and supervised with a care manager. You can also do one that's completely anonymous. And these portals will give you access to, and this would be our vetted, high quality virtual services or educational materials. There's a number of tools, a number of them track your outcomes, measurement-based care. John was talking a little bit about looking forward to seeing the impacts of what Encompas has done over the last 2 years. I think we're just getting to see that, and now we have an outcome measurement-based team, and it's all sort of plugs in through this portal. So it's not only for people who are in active treatment or active counseling or the care manager, it's being used anonymously every day by members that just want to do their own, and usually that can be their initial engagement with Encompas at an anonymous, and it usually does prompt a phone call. So Encompas members can receive counseling in how many different languages? 15. So we have a breadth of therapists that we've built out, and this is, I think, is important, especially as I've been to some general meetings around policing, and I know recruitment, enrollment is an issue, and there's a shortage of police officers and policing members. In communications officers, there's a shortage, and so as there becomes a rollout and more recruitment, I think this is going to be really important, and I think in order for that recruitment to be successful, and I think we have to be aware that some people that are coming in are going to be having multi-language, that we want to be able to support people in their own home language if they wish to, as well as constantly we're bilingual, everything's available in English or French. But these are also the unique languages, 15 unique languages that can be offered. And I think that's going to be a strength of the program, especially for people that are new to policing and coming into a role, that they can get a service in their own language. We, around engagement, obviously we are getting roughly, if you think about those stats, that you get to around, it's an average, I watch it pretty closely, it's an average around 3 people a day. A weekday, around 3 people a day are calling Encompass, and never drops below 2 people a day. Those are unique ones, so 2 or 3 people are always, unique people are calling in and using it, and that's a pretty substantial amount of trust that means we have with the membership. We do a lot of engagement. We try to get out to as many events as we can. Of course, the most common or most popular one is trying to get to Wonderland, get on the roller coasters, but we also happily attend golf tournaments, other charitable things. It doesn't necessarily have to be connected to OPPA, just be where the OPPA members, and we're happy to attend, and we have a ton of fun when we see the members out at those events. We have started, and we've been working on a northern strategy, so we are quite active as an organization in the north already and in remote communities, but we have been building on a remote strategy. We felt it was important. We know that people in the north, like Provincial, feel isolated and alone, and he openly will talk about that with me, which is great, which is a real strength of his. But we did build a northern strategy where we actually want to get more people there. I actually haven't been to see Kirk and Timmins, but we did go and we tried to find Steve in Thunder Bay, rather. But we are trying to get out and be in person in the north. We know that's sometimes a barrier. We went and met with a detachment commander. May have the title wrong. Jen, is that right? I got that title, but we did go and meet. We went to a couple of different branches. We had plans to go more, and actually, when Jen and Louise went to some of the branches, they stayed for the day, so they had people to talk. We also met with retirees, went to headquarters in Thunder Bay, so they spent 3 or 4 days there, and that's something that we'll continue to do, and we will be coming to see Kirk and Timmins very soon, I think. So, did you know, again, along with Rise with Engagement, I think John said earlier in the week that he did tell you that there is an expanded, so now more and more people within the OPP have access to Encompass, and there's actually a shortcut on the cell phone, and I guess our question is, did you know that's on every phone now, every detachment phone? Right language, they have the shortcut of Encompass on it. So if you didn't know that, there it is. It's been put on there. This has been, we've had really great feedback on this. I think we went from a time when we were concerned. There might have been concerns around how related Encompass was to the employer. I think now it's very definitive. And Encompass is run through the association, and it's a safe, confidential place to go, and it's fully supported. So this has actually been a good thing, and we do want to build on this type of easy access that this provides, and we do want to build that and make that permanent in other ways as well, such as looking at app development, and so we get on everyone's individual phones. People can download it if they want through the association. So again, I mean, all of those things have other considerations, but we know it's on the list, and it's been a question in the past as well. So we've been working on that. I'm just about wrapping up here. I don't know if there's any questions, but we certainly, again, that gives you a bit of an overview of what we've been up to, and I think there are some other things on our list for the future. Things we're looking at sleep, and the impacts of shift work and the impacts of that on mental health. We are looking at some of the research and the data that's coming in now, so we're now having enough people utilizing it and using data. We're looking at the data so we can give reports back around specific questions. As you can see, we're starting to track who's working, who's not at work, what maybe some of those numbers might be like in the future. So I think for you, the data that we're collecting will be useful for you taking to lobbying in your roles as representatives of the association. So, last question, I guess on a scale of 1 to 5, how likely would it be for you or a family member to use the Encompas app on your personal cell phone? If there was a video game attached to it. Yeah, that's good. I don't have any, I think we're finished up here, and that's an overview. And if there's any, just want to stick around if there's any questions. If you don't do it now, then I'll be around for a bit more this morning, and then throughout this evening I'll come back for dinner and stay the evening. So look forward to chatting with you individually.
Okay, perfect. Any questions? Thanks again, Carl. Go ahead.
Chief Ferguson, 14 branch. Just want to thank you and your team. You guys have been instrumental in helping our members in the north. Michelle Goldberg, I spoke to her numerous times in the past few years, and over and above what you guys done for our members. So thank you.
Thank you very much. Yeah, it's our, like I said, it's our honor. We've felt very welcomed by members and also just compelled by the amount of engagement and the amount of willingness to grow and set the agenda to be well and to be well at work. So thank you.
Okay, perfect. Thanks, Carl. I think Jay, you said it perfectly, so I won't add anything else to it other than for the whole province, not just the north. Thank you very much. Just before we go,